Quitting smoking is a good idea, no matter what time of the year it is. It's something that those who have lung cancer or know someone who has lung cancer, they're already well aware of that. But there are many causes of that disease, and luckily, many treatments offered at Corewell Health. Joining us via Zoom to share more, Corewell Health pulmonologist, Dr. Gustavo Cumbo. Good morning, doctor.
Good morning, Todd. How are you doing?
I'm doing well. Thank you for asking. Talking about lung cancer, we just wrapped up November being Lung Cancer Awareness Month. Is this still a common cancer, lung cancer?
Unfortunately, it's one of the most common cancers in the world, and it's one of the most lethal cancers. And at Corewell Health, we're proud to have developed programs in order to aim for earlier detections and get much better outcomes for our loved West Michigan population.
Well, let's talk about those outcomes, because it seems more and more each year it feels like the treatments and the outcomes have really evolved.
Absolutely. There has been a trend in less deaths on a yearly basis based on many advancements in prevention and treatment. Unfortunately, we have roughly 240,000 patients in the U.S. that have new diagnoses on a yearly basis and 120,000 deaths a year. So whenever you do some math, unfortunately, everybody has 1 in 17 chances of having lung cancers, and it's much higher among smokers. So it's out there, and we need to get there early, Todd.
My goodness, early detection, always a key factor. But you mentioned 250,000 people diagnosed every year, and half that number passing away. You also mentioned smoking. I mean, that's got to be the main key. I mean, what are some of the main causes beyond smoking for lung cancer?
Absolutely. If you grab any 10 patients that unfortunately have been diagnosed with lung cancer, 8 of them are smokers or ex-smokers. 2 of them may have had some genetic predisposition, maybe some environmental or some occupational. Patients have really a lot of exposures to things that they shouldn't have been exposed to. So overwhelmingly common in smokers, but unfortunately, this can be diagnosed in non-smokers. And still, in this day and age, 80% of the patients are diagnosed at a later stage in which our surgeons cannot cut it out and fix the problem. Therefore, we have to tap into more advanced treatments, yet sometimes the outcomes are not stellar.
So we're looking at early detection really being a factor here, because if this cancer progresses to the point where it's inoperable, the prognoses aren't that great. So what would be some of the other outcomes that are...
Absolutely. Todd, I think always, how is the patient seeing this? There's a smoker that they don't want to come to Grand Rapids. They feel intimidated. We at Corewell pledge for simple, affordable, equitable care that allows for access. We are people just like you that we want to help you. We will speak your language. You can get to us through your primary care doctor. You can refer to any physician in Corewell Health. And then we're going to offer you options, whether it's a preventive CT scan on a yearly basis for us to detect very small cancers that are brewing and patients don't feel it, or maybe something that is in the middle, and we have allocated so many resources in early detection, meaning robotics, meaning genetic testing. And when it's more advanced, then we take pride on having trials for those that kind of skew to one side or the other, personalized medicine, immunotherapy, trials that have been stellar in recruiting patients. So we have a group of physicians and nurses that will accommodate needs to each patient individually, and we really appreciate the opportunity to work with patients that are scared of being a patient with lung cancer.
Well, let's get people more information. Obviously, early detection is just, we can't say it enough, the most important when it comes to cancer diagnoses. If people want to learn more, maybe schedule a test with their primary care physician. Where can they go?
Well, definitely, there's many ports of entry for these patients. The first is a conversation with their families and saying, no, nobody wants to smoke. I want to quit smoking. And if you don't want to quit smoking, let's talk to see how we can slow down. The primary care is an excellent resource to see if you're a candidate for a screening CT scan, low-dose radiation. You sweat it off in a couple of weeks. And then if there's a finding, we have a lot of systems in place to capture these patients and bring them to speak with the doctor. And again, this is what we do for a living. We know that sometimes patients smoke. We know that they have many ailments that are contributing to their condition. We are here to help, whether primary care, pulmonologists, or anybody that can help you access Corewell. Our phone numbers are everywhere to be found, and we really appreciate the opportunity to sit down and in your language with simple words tell you how to move forward all together as a community. We can beat this.
Well, Doctor, I love your optimism. It's great to see your smiling face once more, and we'll get that phone number on the screen for you as well so you can contact them. Or really, one-stop shopping is waiting for you at the website. That's where you're going to get all of the information, including all the different phone numbers you can call. SpectrumHealth.org for more. We'll be right back.